All right, hello.
Hello.
I'm Dr. Ashi, and I'm here with Dr. Preston Rice.
Yes, sir. I'm glad to be here and get into some topics with you.
So, can you tell me a little bit about who you are professionally?
Absolutely. So yeah, a little background. I'm from Atlanta, Georgia. So born
Mhm.
and raised in the South. Went to undergrad down there as well, and then moved up to Chicago for my doctoral part of my uh, education in psychology. So most all of my formative years were culturally down south.
Mm.
And also from a mixed race household. So a lot of the cultural understandings and experiences come from that as well. But found my way into psychology uh, really while in college. I was helping out with my grandfather, my maternal grandfather, who's a Vietnam vet. He's since passed. But during that time, he was having night terrors and I knew nothing about therapy. But I was taking him and joining him in his therapy experiences. And that was
Mhm.
my first taste of really that world at all. And no one in my family knew anything about therapy either. But then I had a conversation with his therapist, and she mentioned, or she kind of hinted at the idea that I should look into it.
Mm.
And my take on that was that she was picking up on maybe more compassion from me, which was probably more innate, my desire to want to understand and just listen. So she picked up on those qualities and said, like, you should look into it. So started to, and that's where the seed was planted, and I realized very quickly that it kind of came to me naturally.
So, today I wanted to talk to you about rage, particularly
Good one.
male rage. And so, talking about trauma too, I think is important here. Um, in your experience working with men that are traumatized from an experience like war, do you think that rage is related to trauma?
Mm, I would say no,
Hmm.
not no,
Oh, wow. Okay.
no. I wouldn't say necessarily to trauma. When I experience rage with clients, this is going to take us away from the war a little bit, just to
Mhm.
make it more general. The experience of rage and even anger is very culturally ascribed.
Mhm.
The expression of rage and anger is usually conditioned, meaning within my household, this is how we express said emotion. And then for men, a lot of times it's more culturally appropriate for them to express anger or rage for a whole host of emotions instead
Mhm.
of crying potentially. That's a
Mhm.
historic, like a classical kind of example. It's more appropriate for a man to be angry than to cry. The
Mhm.
thing with rage and even anger is like it gets confused where my anger or rage is now accounting for when I feel sad, when I feel embarrassed, when I feel shame. It's
Mhm.
talking for all of those things because culturally I wasn't taught at a younger age how to truly express shame or embarrassment or sadness.
Mhm.
If I was a kid, I'm just throwing this example. If I was a kid and I started to cry appropriately because I'm sad, but then
Mhm.
someone came over and said, "Boys don't cry."
Mhm.
It's like my body needs to release this somehow.
Mhm.
And then that household or that community, that environment is telling me, no, but you're allowed to go take that sadness and then go on the football field. And now that's
Mhm.
turning into something more violent.
Mhm.
And I'm learning, I'm being conditioned to express sadness or embarrassment on the football field or in some other kind of violent or just behavioral outburst. And that's kind of
Mhm.
how it gets conditioned in us to be angry and express that for many different emotions or
Mhm.
even rage in the same way.
Wow. So from understanding you correctly, it sounds like so at the bottom level you might have trauma, right? So a man experiences trauma,
Mm-hmm.
and then that can create a number of defenses, which are what we might call like the symptoms of trauma, like the
Mm-hmm.
nightmares and anxiety and stuff like that. And you're saying that male rage typically is not a kind of immediate or organic response to trauma, but that rage is kind of like on an outer level. That when you're socialized to express and feel emotion generally through rage, then what might actually be fear or something else as a response to the trauma that's like a more primary response can come out as rage.
That yes, absolutely. I'd say the
Mm-hmm.
expression of any emotion is so tied to what we're socially and culturally allowed to do.
Mm-hmm.
So you can take the same kind of trauma and the body, for someone in a different culture where the body wants to express it, wants to release it in a feeling, but not
Mm-hmm.
allowed to. So they're not allowed to do anything behaviorally big. So
Mm-hmm.
they're not allowed to go on the football field. They're not allowed to go do the sports or do anything like that. They just have to sit with it.
Mm-hmm.
Can't release it. Now, instead of externalizing that feeling, you're internalizing. And
Mm-hmm.
now it may look more like depression. It may look more like dissociation.
Mm-hmm.
You can't get away from the feeling. You can't let it out. So you just have to take it, sit with it internally.
Mm-hmm.
It's very much what our environment allows us to do. It's how our environment teaches us what the feeling is and how we're appropriately supposed to release it and
Mm-hmm.
what we're supposed to do with it.
So how would you define rage?
That's a good question. We could look this up. Um, how I see it, how it shows up.
Okay.
It's a very, if you're looking at anger, on a spectrum, rage is going to be on a higher end of that.
Mm-hmm.
And rage, I think, not I think, what it looks like in session would be more impulsive.
Mm-hmm.
You're more, or you're less online, frontal lobe wise. There's less reasoning, there's less impulse control there. So it looks more along the lines of out of control.
Mm-hmm.
And in a lot of ways, it is that way. But it's a heightened state of anger.
Mm-hmm.
So in session, it can look like someone's on the verge of panic or they're experiencing panic.
Mm-hmm.
And the things that are coming out, maybe that they're saying, are angry in nature, can be very, very conflict driven in those
Mm-hmm.
sessions. But yeah, it's a heightened state, in my experience, a heightened state of anger, and it feels very uncontrollable.
It kind of sounds like it's like rage is to anger what a panic attack is to anxiety.
It would be very similar to that. Yeah,
Mm.
yeah,
So I
that's
guess
absolutely. Yeah, go ahead. Sorry.
no, no, go ahead.
I was gonna say that's what it shows up as
Mm.
in session. And then based on that cultural kind of social norms, what
Mm.
rage looks like for men versus what I've seen rage look like for women is also very different. But it's still this
Mm.
intense anger if we're gonna
Mm.
kind of qualify it in a way.
Okay, so if we dial it back to just anger,
Mhm.
anger is a primary emotion. What do you think anger is typically in response to, or what purpose does anger serve?
Let me we should talk about, yeah, so we'll go back to my like the theoretical orientation, so just to even explain like primary and even secondary emotions, but
Hmm.
from just like a primitive perspective, I would say anger serves a purpose of acutely being aware. It's driving your senses. Something has made you feel insecure or made you feel unsafe, and
Mm.
anger is a response to heighten your senses so that you're paying attention to this thing so that you can be ready for fight or flight.
Hmm.
And I would say primitively, that's what anger is serving a purpose for. And
Mm.
it's taking in all this information, whatever the threat would be. It's like you're paying attention to that. And now I'm giving this my energy, undivided attention.
Mm. It's kind of interesting because when you explain it on its base level, it makes sense. It's kind of like,
Mhm.
oh, of course, there are ways in which we can feel insecure or our livelihood is threatened. And so we have this response to protect ourselves. And then on a more societal level, right, we hear a lot about male anger or male rage. And
Mhm.
that could be a spectrum from, like the so-called incels that get really angry and even violent at times because of their perceived, um, like kind of in perceived injustice of how they're treated on like the sexual hierarchy to women saying like they'd rather be locked in a room with a bear or something than a man
Yeah. Yep.
because men can be so scary and threatening.
Hmm.
And these two things sound so negative. And beneath that, you're describing something that sounds not necessarily positive, but it's just reasonable.
Hmm.
And so how do you conceptualize what we might say is like a healthy anger and then a more toxic or antisocial one?
Okay. So I'll take a step back and explain the theory that I use to make sense of this? Because it's a
Okay.
really good question. And to be able to explain it from a clinical perspective, to be able to explain it in layman's terms to anyone is super important.
Hmm.
But I use a theory called emotion focused therapy or EFT.
Hmm.
I also use internal family systems. That will depend on who's in front of me and what language makes the most sense to that client.
Hmm.
But from an EFT or emotion focused therapy perspective, I would explain it from a primary emotion and a secondary emotion in that way.
Hmm.
What we're trying to do is learn what our primary emotions are. What gets in the way is our culture, and it teaches us that
Hmm.
if I am angry, it's more appropriate to explain it through, I don't know, let's say, um, because this will be different depending on the gender norms. But let's say for a guy, let's do rage, for
Hmm.
instance. So rage. So I'm raging and I'm breaking stuff, I'm throwing stuff, I'm punching through walls and that and all of those different things. And
Hmm.
then from a therapist perspective, I'm listening to the client. I'm like, okay, so when you get this way, what's happening in your mind? What are your thoughts?
Hmm.
And the client starts telling me, well, after they've calmed down, of course, they're like, well, um, I don't know, this guy pissed me off, or my boss really pissed me off, or I came home and my partner just kept asking me to do more and more and more. They didn't listen to me. They didn't acknowledge anything that I've done before. And it's like you're going with that. And what I'm picking up, the theme here is some form of like, I'm not feeling seen, I'm not feeling heard. So I'm going to say that to the client. I'm going to say, hey, what's it like when you're not seen or heard? I hear you showing me the rage, but like when you're not seen or heard, what's that feeling like? And then we're getting a layer deeper, and maybe they say something like, I don't know, it makes me feel like I failed or something like that. Like I'm not seen or heard. I feel like I'm messing up. I'm failing. It's like, well, what's so bad about not failing? And we're going a layer deeper, and we're trying to get to the primary reaction, the primary emotion. And if we can get there, when we get there, that's what we're going to learn to communicate. But for this client, I feel like a failure. What's so bad about being a failure? Well, I feel like if I'm a failure, I'm going to be rejected. I'm going to be abandoned. And that is an angry response to the world rejecting you.
Hmm.
So if we're talking, I know it's rage, but underneath that, I'm angry because I feel like I'm going to be rejected. And think about a child being rejected, being abandoned,
Hmm.
and like anger is that feeling for that child.
Hmm.
Okay. Child can't be rejected, can't be abandoned. The child can't care for themselves by themselves. They need other people to take care of them.
Hmm.
So that child now grows up with this angry response to failure and things of that nature. And it just evolves. It just gets bigger and bigger and bigger. And now as an adult, it looks like rage.
Hmm.
But talking with this client, I can help that client understand. It's like when I'm raging, I'm really angry underneath. And I'm angry as a child underneath when I feel rejected because I can't be alone. I need someone. And maybe being angry puts me in this hyper focused state where I'm focused on whatever this person that's about to leave, whatever this person's about to leave, I'm going to focus on what they need. And if they're not listening, I'm going to act out just to get their attention on me. And if that client can understand when I'm raging, this is really what I'm insecure about, let me talk about what I'm insecure about instead of punching holes in walls.
Hmm. Hmm.
And that's the point. That's the value of EFT. Is like we understand, okay, the secondary emotion is this thing, the primary emotion is underneath. Let me talk, which is way more vulnerable, way more scary. Let me talk about my primary emotion, and you get a healthier reaction from people.
So if you can get, let's say from an extreme example, right? Because
Hmm.
everything you said makes so much sense when we're talking about what we call
Hmm.
incels, right?
Hmm.
Because it's this rage response And often what they say is basically what you said, right? They'll actually admit it too. They'll say like I've been rejected for so long
Hmm.
and it's not fair. And then they have all these other ideas around, a very superficial way of viewing attraction and sexuality in women. Um, and there seems to be like a kind of entitlement there too that can be very dangerous. But if you take someone like that who's having that rage response and then you can bring them into a more vulnerable place of saying, you know what, I honestly just feel rejected and I'm scared and I'm
Hmm.
sad. What do you do next? How do you channel that towards
Yeah.
something else?
If you can, it's hard, but if you can get someone to that vulnerable state where they're just saying, I'm hurt, I'm sad, the thing therapeutically, what you want to do is hold space for that. And that's a term we say, but what that actually looks like is I'm not going to let you, because we've met many times and there's some safety and there's rapport building. I'm not going to let you get away from that feeling.
Mm-hmm.
It's so uncomfortable to feel rejected and sad.
Mm-hmm.
So much so that our bodies, not well, we're not thinking about this, but our bodies dislike that feeling so much that I'm gonna help you get out of that headspace and go somewhere else. So I'm gonna go to anger and rage instead of
Mm-hmm.
sitting with just being sad.
Yeah.
So as a therapist, I'm gonna help you sit with just being sad. And now what we'll see is because my behavior in that moment, which could just be crying, I mean, let's go extreme, crying like uncontrollably crying on the ground in a fetal position, just
Mm-hmm.
vulnerable, just
Yeah. Yeah.
naked emotionally. I'm doing that and it's linked to actual sadness. So it's congruent.
Mm-hmm. Mm-hmm.
I'm feeling sad genuinely. It's a primary emotion and I'm expressing it in a very appropriate way.
Mm-hmm.
I'm not avoiding the feeling anymore. What you're going to see is that the thing we fear, which is like once I start crying, it's never going to stop. That won't actually happen. It will stop. It may
Mm-hmm.
take a second, but it's going to stop.
Mm-hmm.
And that is the start of a new way of releasing this true emotion that you feel. But
Mm-hmm.
you have to learn to sit in it because your mind is amazing at trying to distract us. It's amazing at helping us defend that feeling and get away from it.
Mm-hmm.
And therapeutically, I'm going to help that person sit in it.
Mm-hmm. Yeah, I mean, you're right that's really the hardest part is getting to that place, especially for men.
Hmm.
And it's ironic for me too because I'm also a psychologist and therapist, and I work with a lot of men who have cried in my office,
Hmm.
and men who also really struggle to get there. And I personally struggle to get there.
Hmm.
Like I genuinely, it's so hard for me to cry. And if I start to feel emotions welling up, I don't go to rage. I typically go to humor.
Yeah.
And that's probably a more pro-social response,
Right. Yeah.
but it's automatic. I remember when I was younger, feeling sad and actually sitting on my bed alone in darkness in my room and trying to cry. And I would tell myself, no one can see you. No one, literally, you're alone in the dark. No one will know. You don't have to tell anyone. And I still couldn't cry.
Yep. Yep. I went from fifth grade to 25 without crying.
Mm,
I didn't cry at all. And I'm 36 now. So I
mm,
haven't even been crying that long. But at 25, I had to relearn how to do it. And if you think of
mm,
crying as just a muscle, it's like you have to work it out. That thing atrophied for a very
mm,
long time for me. Um, yeah. And it was for me, the workout for that muscle was watching, funnily enough, soldiers come home to their animals.
mm,
And
mm,
I would feel some tinge in my heart that was just like, I would say not even heart, not trying to, but feel it. There's something I was like, that's meaningful. That makes me
mm,
like really happy, sad. It's just emotional. I'm like,
mm,
hold on, what is this? Let's try to use these videos and like actually cry. So I'd go to the bathroom, look in the mirror, and I just
mm.
rehearse it and rehearse it and rehearse it and just look and look and look. And then
Wow.
eventually a tear came.
Mm,
And then that was the first time I'd cried or let a tear out since fifth grade. And then I
mm,
just do that over and over again. And eventually I was able to diversify that muscle into many different emotions.
mm.
but it does take practice and time.
Yeah, it's interesting because for me, um, similarly, things that have made me get to tears is music and then usually
Yes.
like scene from like a movie or something.
Yeah.
And sometimes it's things that are not even necessarily sad in a kind of stereotypical sense, like, oh, someone dies.
Hmm.
Um, Sometimes it's moments of just like incredible love or like connection or loyalty. These things can connect me to my emotions. And it's kind of weird that that's, like when you describe soldiers and their pets, that's actually not, those aren't necessarily sad on like some level.
Hmm.
Mm.
I think that's the thing. So it's very subjective in that position. Um, and which is what I was learning about because I could watch one video of a soldier coming home and have many different thoughts about it. And I
Mm.
got to a place when I first started, it would just be one thought, which was, I'm sad that I had to leave the dog.
Mm.
And then that was the only kind of thought that would get me to tears. And then I was able to again diversify it where it could be the happiness of coming home, the relief, even from the dog's perspective and
Mm.
then take dog out and you're like a human. And it's like it's just that's a subjective piece of it. But if you and I were working together, me as therapist, I would help you understand it's like, what about this thought from a song? What
Mm.
about the thought is allowing you to be emotional, is letting you get to that place? And you'll learn quickly is like there's some thought processes that my defenses come up and I can't access it, and other thought processes which I'm allowed to be more vulnerable and my mind won't distract me from it. It'll let me sit in it a little bit longer. But it's knowing yourself and exploring all those hidden corners in your mind that your body just usually won't let you spend time with. And it's like that's where therapy is helpful. And I won't just say therapy from like this therapist client perspective,
Mhm.
even a friend that won't judge you
Yeah.
it,
Yeah.
any kind of space that allows you to say what you need to say without judgment or shame, that's safer to be vulnerable. So if you
Mm.
find that space and then you have this other person that can kind of help you stay in that vulnerability a little bit longer, it is helpful to have another person because our minds we're too close to the feeling when it's just us. You kind
Mm.
of need that other person to be like, I see you're using humor again. It's like try to say that again without laughing. Try to say it again, and it's like it helps to
Yeah.
have that other party.
Mm. I'm sure you've had this when clients, men come to you and they say, I haven't cried, or they have trouble. Do you have any specific ways, like watching movies or something like that, to
Yeah,
help them connect to their emotions?
yeah. I would when someone says they haven't cried, I already know tears, and I would say that's such an umbrella kind of expression. Just as we were saying with rage,
Mm.
um, you could be crying for happiness, for sadness, for loneliness, for grief, loss. It could be a lot of things. I would ask that person, what do you want to cry about? Let's start there.
Mm. Mm.
Is there a specific grief is a good example there? It's like someone, I just lost someone important to me and I don't feel anything. And like,
Mm.
do you then want to cry about that? Is that what you think would be the appropriate
Mm.
response? And then if they say, yeah, then we're going to work on that.
Mm.
And we're going to work on that specific thing. And we'll get
Mm.
into it about the memories, the thoughts, the feelings that come up. And then I'm going to help them get to the place of like, oh, this is why I can't cry about this thing.
Mm.
And then we work on telling that narrative, telling that story, telling that memory. And then every time the body tries to get that person away from it, I'm going to stop it and be like, do it again, try it again.
Mm.
And that's how I would help them with that one experience. Now,
Mm.
I want to also cry about happy stuff. Same kind of workout.
Mm. That's such an interesting question. What do you want to cry about?
Yeah. What do you want to cry about?
Because I think many men would have an answer to that question.
Hmm.
They would say, I can't, but I want to. And if I could, I would cry about this thing.
Hmm.
So that's
Yeah.
that's really fascinating.
And even with that, it's like that's super common. to like experience and hear someone say. It's like I want to do that. And usually the fear underneath that is when I start, it won't stop. I can, I don't even have a stat on that, but it's so common that that's the fear. If I let these emotions out, it won't stop.
Mhm.
And it will. It will.
I think it goes back to anxiety too, is a lot of the fears with panic attacks or anxiety is that if I, have a panic attack, I'm never gonna come back.
Mm-hmm.
And we know it does, right?
Yeah.
It only lasts a few minutes.
Yep.
It's just like how it works physiologically.
Physiologically, yeah.
But we tell ourselves and we feel in that moment, this could last forever. And that would be so terrifying
Hmm.
or
It's
painful.
that's a slick way the mind works to keep us from going over there and sitting in that
Mm,
space.
mm,
And it's only doing that to protect us. I
mm,
say only. My belief is that it's doing that to protect us.
mm,
Like it's like that's a sucky feeling over there. Let's not go over there because if we go over there, it's never gonna stop. It's never gonna feel good. So like
mm.
just go do this over here.
That's interesting because we were going to talk about male rage and we spent a
Yeah.
good portion of this talking about sadness.
Yeah.
Do you think that sadness is always beneath rage or anger, or is there always a more sensitive aspect to it? Or do you think that anger can actually have a more almost like a justifiable response that isn't necessarily vulnerability, that there's utility to going to that place?
Yeah, absolutely.
Mm,
With all the primary emotions, there, yes, 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 yes.
mm,
Um, I think in a congruent sense where I'm primarily emotion is anger and an appropriate time would be like a fight or flight situation, life or death. Like
mm,
you need to be angry right now.
mm, mm,
If we were in a life or death situation, I need this thing to come out for survival. Absolutely.
mm.
Absolutely. It is appropriate.
Yeah, so if you come home and there's somebody with a knife to, your
Mm-hmm.
loved one's throat,
Mm-hmm.
going into fetal position and crying is not gonna
Not
help
the
you in that
time for it.
situation.
No, no, no. We'll do that later. We can talk about
Mm,
how scary it was later. Right now, you need to lock in and defend.
mhm.
Absolutely.
Yeah, so it seems like part of the conversation around anger shouldn't necessarily be that anger is inherently negative or
Mm,
bad. It's just that anger is often used to mask other emotions or experiences that are otherwise helpful but painful, or society considers them not masculine or somewhere
mm,
we can go.
yep.
And on the other side of this is that it's actually can be very helpful in certain situations, and we don't want to just get rid of that
Mm,
completely.
100%. I think it's understanding really what we're trying to communicate. And then socially, societally, culture is always shifting. It's always evolving. It's moving back and forward all the time. And it's like, from our perspective as therapists, it's very important to keep your hand on the pulse of what's happening. And when we talked about masculinity earlier, it's like it's just changing. And I don't think this is a new thing. I think just history for the sake of human beings.
Mm,
Um, it's always moving. And I think that's innate to just being human being. We're always trying to do something. We're always trying to figure it out. We're always trying to move. And then I think this is just kind of the cycle that happens. And I'd
mm,
say from a psychology, now this is me speaking just personally, it's like from a psychology perspective, we have 100+ years of it written down. And that's just trying to understand what humans are, what we're doing, what's the purpose, what, why
mm,
we're winning, all of that. And I think even before psychology, humans have been trying to figure this out. And then
mm,
we get into all the scriptures, all the religious teachings, all the spiritual teachings. It's all trying
mm,
to explain that thing, those same questions.
mm,
But I think the shift in culture is always happening. And
mm,
right now, at least in the West, and I argue globally, but in the West, we're trying to figure out what masculinity is for a while before now. And
mm,
even now, masculinity and power hand in hand.
mm,
And that idea was really it was used and still being used in a very toxic way.
mm,
Um, and it got paired with that. Being masculine was toxic in power,
mm,
oppression. And it's like that. I don't know when the last time that wasn't the case, but I don't see that it always has to be that way.
mm,
And a
mm,
lot of societies of recent have been based on religious scriptures and beliefs
mm,
telling us what masculine is.
mm,
And it just seems like we're in a time where we're trying to redefine it. I just don't think that that piece, the redefining piece, is new. I think it just always happens in human
mm.
history.
What this came up with my conversation with Oscar is, what does
Hmm.
it mean to be a man? Or what is
Yeah.
masculinity? Do you have a sense of what masculinity means to you, or is the word itself almost creating a label that is getting us further from the point?
I don't think I think it is, but I don't think it has to.
Mm,
In the way that I approach it in my household, how we approach it would be masculinity embodies, from a social perspective, embodies certain behaviors and ideals, but from a gender perspective, it's not attached to it. My
mm,
wife would do more masculine things and I would do more feminine things, and we would transition those roles. We could both
mm,
step into certain aspects of those things. I don't
mm,
think it has to be tied to that, but I do see that our society is doing that.
mm.
Um, I hope, did that make sense?
Yeah, I think this is a complex conversation, right? Because then
Hmm.
it becomes, well, what is masculinity? And if your wife, who's a woman, is doing something masculine, then why should we call it masculine? If both
Hmm.
men and women are capable of going to these spaces, why not just say they're all different ways of being a human being
Yeah,
and move away from the labeling as masculine or feminine?
I understand that perspective
Hmm
100%. And the way that I would make sense of it is masculinity is a term that's highlighting certain ways of being.
mm
And then it's my belief, and I understand totally if people disagree, but my belief is that different genders can go into that way of being.
mm. Do you think that the reason that we might call something masculine or feminine is because on average, men tend to exhibit these qualities or and vice versa?
No, it's a good question. I think more nowadays it's based on the history of using that language. And I think culturally we're
Mm-hmm.
trying to change the definition of it, which is why it gets murky.
Mm-hmm.
But I can imagine a world where feminine traits were called masculine, and now we're having
Mm-hmm.
the same debate just in the other direction.
Mm-hmm.
It's a term trying to explain certain traits. And I don't think a lot of those traits are inherent to being male at birth or female at
Mm-hmm.
birth. I don't think that that's necessarily the case.
Yeah, it's interesting just to consider how much of our ways of using language and thinking about things are the legacy of culture
Hmm.
across time. And there's no real reason to label, you know, things that come to mind is like holding a baby or a
Hmm.
puppy, right?
Hmm.
People might say, "Oh, that's a more feminine act."
Hmm.
But in reality, men across all time have held babies and puppies.
Yeah.
It's not like we're not capable of that.
Yep.
And women across time have engaged in physical violence and have gotten excited about sports and
Hmm.
these things that are masculine. And so it's kind of odd that we even label these things when if we were to kind of like step away from those labels, what we might find is something much different than the reality that we tend to sit in.
Yeah. Yeah, absolutely. And I feel like if we dug down deep, and people have done this, so we're not reinventing it, but it's like do the work, do the exercise. If you're going to
Mhm,
say something's masculine, look it up and tell me what you're trying to say. Same thing with what we're doing emotionally in the therapy space. Like if you say you're raging, it's like tell me what that looks like. There's usually
mhm,
something underneath from a primary emotion. So if you're saying masculine and you're judging others based on that, tell me what you're specifically seeing, what
mhm,
behaviors those are, and are those just anything? Is it just a strength-based thing?
Mhm.
Is it just the way I'm dressing? And it's like, can it only be this one type of person doing it, or can that change? And if it does change, what are we calling this other thing? And it's just trying to define the word, and we're trying
Mhm.
to change that definition
Mhm.
currently. And that's what, again, what makes it so tricky.
It's funny because as we're talking about this, I personally find it very interesting. And at the same time, it's very destabilizing, right? Because you're starting to question, oh, what is masculinity? Who am I? What is my identity? What is the world? And
Exactly.
I think that can be so uncomfortable for people that having this rigid, men are this thing with beards and shields
Hmm.
and, Spartans, and then women are this thing, which is, with the kids and whatever. Like this is like the traditional, more conservative way of viewing things. And I can sense emotionally for me that exhibit being in that space can also feel more comfortable because things are defined more clearly and you can make sense of the
100%.
world in a way that's meaningful.
That's the power of language for us, for our
Mhm.
species. And I don't just mean what we say verbally, non-verbally too. It's like
Mhm.
how we're communicating is really important because that communication can either heighten our anxiety or lower it.
Mhm.
And that's the value of language. And when we're
Mhm.
starting to change it, it's like, wait a minute, I thought I knew what that meant. Now I don't know.
Mhm.
Oh, this is unpredictable now. I can't really plan for this. And now we're in a more cortisol going on, and
Mhm.
our body doesn't like that. So it's going to push back.
Yeah, and then the cortisol is also not necessarily the response that is going to always happen in that situation. It depends on how it's presented. And if you're purposefully going to this place, showing curiosity, then you're not necessarily going to have the fear response or the stress response. Then if you're on Twitter or something, right? And you're reading something that just seems totally out of your comfort zone, like men wear lipstick or whatever, right? And it's like,
Mm-hmm.
oh, right, this is shocking to me. And at the same time, there's this area where you could sit and be, well, can men wear lipstick? What is
Yeah,
lipstick? What is the point of lipstick? And it's totally relative to the context.
100%. Yeah, it's absolutely relative to it. And it makes you question things. And then it's how flexible am I? How
Mhm.
quickly can I decipher am I safe or unsafe?
Mhm.
And then how open am I to different perspectives?
Mhm.
How isolated is my worldview? All of these things. And if you're not used to different things, it's going to throw your body off, and your
Mhm.
body's going to respond with a stress response.
We're we're out of time, which is crazy. It's went by so fast.
Oh, it
But
did.
one final question is a lot of men will be averse to therapy because they say, oh, it's like you go, you talk about feelings, safe space, right? This is just
Yeah.
nonsense. What do you say to that? Like, do you have a response to that? And how do you pitch therapy as a guy to men?
Right. That's 100% right. As stereotypical as it is.
Mhm.
The first thing I do is try to normalize what feelings and emotions are, and explain why I use them, why I'm asking you what feelings are, what
Mhm.
emotions, what's the value in that. And usually, just by explaining how it's being used as a language, we can usually get to it. And then following that up quickly is again holding a space where you can say whatever, and I'm going to show you what unconditional acceptance looks like and feels like.
Mhm.
There's no judgment here. There's no shame here. I'm no different than you. I'm also struggling with my own stuff. And it's like what we're doing in this space is allowing you to learn about yourself. And if you're
Mhm.
stepping into this, whether it's virtual or physically here in this office, like you're already taking the hardest step, which is
Mhm.
coming and showing up. And then again, just by explaining what emotions are and why I'm tracking feelings and trying to get you to understand your feelings, it's just a language thing. It's what your
Yeah.
body's trying to tell us.
And so if a guy says, okay, let's say I go to therapy, I get in touch with my feelings, and I'm able to go there, how will my life look different afterwards?
Yeah,
What's the
yeah.
point?
Um, yeah, that's a good question because it summarizes kind of everything we were saying.
Mm,
To even understand what you're feeling is the process of defining it and going deeper, 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 deeper.
mm,
In that process, there's no way to get deeper unless you're more vulnerable.
mm,
And just in doing that process of getting more vulnerable, you're redefining what your body's afraid of. Your body's afraid of being vulnerable because maybe in the past it was and it hurt you, it was used against you.
mm,
So just by us trying to understand what's underneath, we're being more vulnerable and I'm not hurting you. You're not getting
mm,
hurt. So now your mind has an example of like, oh, I did say I was crying and nothing bad happened. Immediately, we're already
mm,
fighting what happened in childhood potentially. Because
mm,
like just the process of understanding, great. Now when we get down there, I'm gonna help you sit with it and not avoid it.
mm,
And already there, your body's building more confidence. Like, oh, if we do cry, I have the skills to handle it. I don't have to be
mm,
afraid anymore. Now we're
mm,
challenging this narrative that we had as a little kid. Like
mm,
tears bad. Tears aren't always bad. And if they do hurt, I can help us. I can help myself. It's gonna be
mm,
okay. So we're just redefining this narrative that we tell ourselves, and we're building
mm.
in the skills.
Yeah, so ultimately you get a man who is in the world in a way in which can feel their emotions more authentically,
Hmm.
and it doesn't have to be a bad thing. It can actually lead to more emotional relief
Yeah,
and more flexibility in how they engage in the world and talk to people and experience their life, it sounds like.
yeah. I'd say the first step is understanding it and realizing it for themselves. Part two could possibly be where we talk about how you learn to communicate it. That was a very
Yeah,
different
yeah.
thing. But first step for sure is even
Mm,
understanding what it means for yourself. What does rage and
mm,
anger really mean for me? And then how do I communicate it?
mm.
That would be part two, I would say.
Yeah, I'd love to do part two. I really appreciate you doing this. This was great.
This was really good. Thank you for setting it up.
Yeah, and I want to let you go because we're out of time, but uh, thanks again, and we'll talk more soon.
Absolutely. Take
All
care.
right, all right, bye.
Bye.